the founding of DeLorean AI really goes back to pre-college, and I grew up in southern Rhode Island, in North Kingstown and Narragansett, and I grew up on a farm with cattle and sheep and turkeys, and the smartest person that came to our farm was our veterinarian. And I thought, hey, I want to be that guy. And so his name was Dr. Kaplan, and so I applied to one university because it had the largest dairy farm, and that was Cornell. And when I got to Cornell, I still wanted to be a vet, but I found that I was more interested in research and understanding why things happen versus treating the symptoms. And during that, I did a number of different internships, and one of them brought me overseas to Scotland, where we did work with embryos and cloning. And I wanted to do my PhD there, but unfortunately it was mad cow disease and foot and mouth disease in the early 2000s, late 1990s. So I had the opportunity to pursue my PhD down in Australia. And we had such a large cohort of experimental animals, and we had genomics and proteomics and DNA and RNA, that we required a mainframe computer to do the statistical analysis. And when we were doing this, I was wondering, why don't businesses use this type of analysis to make better business decisions? And when I came back to the United States, I was with a company that fortunately was backed by a number of investors that during the crash of '08 wiped out. And so to get a job, I worked for a consulting company, and I in that consulting company, created what was called strategic analytics. And so that was the basis of data science, if you will, there, and helping companies in 2009 utilize that data. I then moved on to blood banking, and we turned around the American Red Cross's capabilities from being $1 billion in the whole to being $600 billion profitable using data science and analytics. And then I thought, well, if we could be successful here, why can't we be successful in other industries? So I founded McLaughlin Global Innovations and Investments, and we were starting to work. That was about the time of the electronic medical record was coming online from the Clintonian legislations from the 90s. So you had Epic and Cerner, but also Meditech. And so we started working with those companies, and then Cognizant Technology Solutions came knocking, and I became their global head of AI for healthcare and life sciences, so the payer, provider, pharmacist, the government, and we did great things there. And then I was headhunted to Capgemini to be their chief of intelligence or chief of AI for the Western Hemisphere. And all lines and verticals reported up to me, and so I was in charge of the AI from Chile all the way up to Canada, we like to say. But when I was there, we were throwing machine learning engineers at a wall of data for clients. And every time we did a project, it was de novo. So we would start from the beginning. We were not focused on product. And I had a vision that we needed to do two things. One is we needed a product that could scale across different industries and different companies. And the second is that it needed to be applicable to patient health, rather than the bureaucracy of healthcare. And that's what, the consulting we were doing was mostly about claims adjudication or claims processing or enrollment, but it wasn't getting any patient better. At the same time, my father became ill and passed away, and he had said always take chances. So at that point in my life, I was looking at two large consulting companies to bring my practice to, and I was talking to a good friend who's from EY and now at NVIDIA, and he's like, Seb, if you're willing to be poor for a couple of years, then you could have something that could truly impact humanity. And I knew that companies wouldn't be able to do this until they put a group of individuals in a room for a number of years to solve the problem. And so what I did is I sold my house and all of my investments, and we put those individuals in a room. So to be able to be successful, you had to have the data, the talent, and the scientific method. And we had the scientific method and the talent to do this. Companies that could do this would need to have the data, so any of the large BUCA insurance companies are the only ones that could do this. But they would not put a red number or dedicate that many staff to a group or to a project that would go into the negative, but we would. So I sold my house, I sold all my investments, and I put it into the company. And 4 years later, we had the ability to drive a product called medical AI.